There are some things in our life that are supposed to be private. And these things that are private means that it's not going to be exposed to the general public, and it's not everybody that will know about it. That is for things we want to keep private in our life. In teaching a child what private areas of our body or his body is, we want to make sure that we let them know that these private areas are supposed to be covered. They are supposed to be just for them. And this is an age-appropriate information for children between the ages of 3 to 7 or thereabout, where you teach a child that there are parts of our body that are private, and these private body parts are supposed to be covered. And you can use example of areas where underwear is covered. For girls, their chests, in between their legs. For boys, in between their legs. These are areas that your underwear is covered. So when you want to teach a toddler or a young child about private body parts, you can use these instances of wear clothes, wear their underwear covered, to let them know that these are private. And then there are rules governing these private areas. It is meant to be covered. It is meant to be seen by just you and few others who want to help you because they want to bathe you or you went to see a doctor. And so you have to pick these 3 rules for them. Number 1, no one should touch or look at these private areas unnecessarily unless your parents want to bathe you or your caregiver want to give you a bath or something went wrong there and they are trying to check, either taking you to a doctor or they want to see whether you have injuries in that area because you give complaint. Apart from that, there are your private areas that you need to protect. If someone else tells you to open it or that they should touch it, let them know that no, it is private and it belongs to you and you alone. It is your body and it is your body alone. Nobody has the right, the authority to do what? To touch it. Then another one is you should not touch someone else's private parts. Okay, this is something we want to send out to our young individuals. Don't touch another person's private area, and nobody should touch your private area. That way you are teaching the child that on no circumstances and on no ground should a private area be touched unnecessarily, whether by your friends, whether by an adult, whether by anyone. Nobody should touch it. Rule number 3 in this teaching is, if someone asks you to see or someone asks you to open this private area, say no and run away from the situation. If the person say, let me touch your own private area, tell the person no and run away. So if you are a caregiver or you are a parent, teaching this topic to your young individuals between the ages of 3 to 7, you try to make it clear that there are things in our life that need to be private, and your body, there are some parts that are private. In between your legs are private, your chest for girls are private. Nobody should touch your private part, and you should not touch another person's private area. Nobody should ask you to open your private area, and you should not ask anyone to do such. That will help the child to understand that these areas are sacred, they are private, and it's just for the individual that owns them. Apart from the fact that you take a visit to see a doctor because of a medical checkup, and the doctor wants to examine you, or your parent wants to bathe you, or that you complain of a pain, a bruise, or something that went wrong in that area, that a well-meaning adult in your life want to check whether something is wrong in that area. Then there are some play out scenarios that you can play out for the child. For example, you let the child know that if somebody tickle your private part, that's a warning sign that the person wants to molest or abuse you in some ways. So sound alarm and run away. Okay? Nobody should tickle you, touch those areas, or ask you to open it for him or her to see. If you are bathing and somebody walk into where you are bathing and want to touch you and inappropriately, tell the person no. Or you are alone in the house and somebody walk into the room and say you should undress, that is a warning sign that something is wrong. Sound an alarm, tell a well-meaning adult. Remember, we have been on this series. You've already know what boundary setting is, and you've already know those who should be termed as trusted individuals in your life. And so you run to this trusted individual. It can be your parents, your caregivers, a well-meaning adult in your life, your teacher, your counselor, the authorities, law enforcement agency or authorities who can be of help to you at this instant. So try as much as possible to let your children know about this. Remember that we have age-appropriate information for your preteen, your toddlers, and your teenagers. This lesson I've just talked about are for children between the ages of 3 to 7. These are ways you can teach them what their private part is and how they can keep it sacred and safe. Remember, your safety as a young person is our watchword. As a toddler, as a preteen, or as a teenager, we don't want you to be molested. We don't want you to be unsafe in any way. We want you to be confident. We want you to have people you trust in your life. And we want you to have those that you can communicate your feeling when you see that you are in danger. So keep areas that are private. Close those areas that are private. Don't allow anybody to go near or touch, unless for those you trust that know that something is wrong with you somehow.